Hey there, and welcome to our video on supplements for high blood pressure. In this video, we'll be diving into the latest research to explore which supplements may help lower blood pressure and support cardiovascular health. We'll cover magnesium, vitamin D, potassium, CoQ10, garlic, and L-arginine, examining the scientific evidence behind each one. By the end of this video, you'll have a better understanding of how these supplements work and whether they might be right for you. So let's get started. High blood pressure, or hypertension, affects millions of people worldwide. While lifestyle changes like a healthy diet and regular exercise are crucial for managing blood pressure, research suggests that certain supplements may also help. It's important to note that supplements should not replace medications prescribed by your healthcare provider. Always consult with a qualified professional before starting any supplement regimen to ensure safety and avoid potential interactions. First up, let's talk about magnesium. A meta-analysis by Zhang and colleagues in 2016, published in the journal Hypertension, found that magnesium supplementation at doses of 365 to 450 milligrams per day for an average of 3.6 months significantly reduced systolic and diastolic blood pressure in individuals with chronic conditions. Magnesium works by increasing nitric oxide production, which helps relax blood vessels. The authors also observed that every 100 milligrams daily increase in magnesium intake was associated with a 5% reduction in the risk of developing high blood pressure. However, magnesium supplements can cause side effects like gastrointestinal discomfort, so caution should be exercised, especially in those with kidney disease. Next, let's discuss vitamin D. Studies have shown that individuals with high blood pressure tend to have lower vitamin D levels compared to those with normal blood pressure. A meta-analysis by Foreman and colleagues, published in Hypertension in 2013, found that higher blood levels of vitamin D were associated with a reduced risk of hypertension. In fact, individuals with the highest vitamin D levels had up to a 30% lower risk of developing high blood pressure compared to those with the lowest levels. While these observational studies suggest a potential protective role of vitamin D against hypertension, more research is needed to determine if vitamin D supplementation can significantly lower blood pressure in individuals with pre-existing hypertension. Potassium is another essential mineral that has been studied for its potential blood pressure lowering effects. A review of 23 randomized controlled trials by Filippini and colleagues, published in the Journal of the American Heart Association in 2020, found that potassium supplements led to a modest but significant reduction in blood pressure compared to placebo. Potassium works by promoting sodium excretion and helping blood vessels relax. However, high-dose potassium supplements can cause side effects like nausea and should be used cautiously, especially in individuals with kidney problems. Moving on to CoQ10, or coenzyme Q10, an antioxidant involved in energy production within cells. A meta-analysis of 17 randomized controlled trials by Tabrizi and colleagues, published in the journal High Blood Pressure and Cardiovascular Prevention in 2018, found that CoQ10 supplementation significantly reduced systolic blood pressure compared to placebo. While the exact mechanisms by which CoQ10 lowers blood pressure are not fully understood, it's thought to involve its antioxidant properties and ability to improve endothelial function. CoQ10 supplements are generally well tolerated, but the optimal dosage and long-term effects on blood pressure still require further investigation. Garlic has been used for centuries as a natural remedy for various health conditions, including high blood pressure. A meta-analysis of 12 randomized controlled trials by Reed, published in the journal Experimental and Therapeutic Medicine in 2020, found that garlic supplementation significantly reduced systolic blood pressure by an average of 8.3 mmHg and diastolic blood pressure by 5.5 mmHg compared to placebo. The authors estimated that this reduction in blood pressure could potentially decrease the risk of cardiovascular events like stroke, heart attack, and coronary artery disease by up to 40%. The blood pressure lowering effects of garlic have been observed with various preparations, including raw garlic, aged garlic extract, and garlic powder supplements. However, High doses of garlic supplements may cause side effects like gastrointestinal discomfort and can interact with certain medications, so caution should be exercised. Lastly, let's discuss L-arginine, an amino acid involved in the production of nitric oxide, which helps blood vessels relax and dilate. A meta-analysis by McRae, published in the Journal of Chiropractic Medicine in 2016, found that L-arginine supplementation could reduce systolic blood pressure by 2.2 to 5.4 mmHg and diastolic blood pressure by 2.7 to 3.1 mmHg in adults with hypertension. While these reductions in blood pressure may seem modest, even small decreases can have significant impacts on cardiovascular health at a population level. However, more research is needed to determine the ideal dosage and long-term safety of L-arginine supplements for blood pressure management. It's crucial to emphasize that while these supplements have shown promise in reducing blood pressure, they should not be relied upon as the sole treatment for hypertension. A holistic approach that combines lifestyle modifications, such as adopting a heart-healthy diet, engaging in regular physical activity, managing stress, and adhering to prescribed medications, remains the cornerstone of effective blood pressure management. Individual responses to supplements may vary, and potential interactions with medications or other health conditions must be considered. Always consult with a qualified healthcare provider before starting any supplement regimen to ensure safety and appropriateness. While the current body of research provides valuable insights into the potential of various supplements for blood pressure management, further studies are needed to address several key areas. These include determining optimal dosages, treatment durations, and long-term safety profiles for each supplement. Additionally, more research is warranted to investigate the potential synergistic effects of combining different supplements or using them in conjunction with lifestyle modifications and conventional treatments. In conclusion, the research surrounding supplements for high blood pressure provides valuable insights into their potential benefits and limitations. Several supplements, including magnesium, potassium, CoQ10, garlic, and L-arginine, have shown promise in helping to lower blood pressure based on scientific evidence. However, more robust studies are still needed to determine optimal dosage, treatment length, and long-term safety for each supplement. Remember, supplements should not be used as a substitute for medications in those requiring treatment for hypertension. A holistic approach that combines a heart-healthy diet, regular exercise, stress management, and appropriate medical treatment remains the foundation of effective blood pressure control. Always consult with a healthcare provider before taking any supplements to ensure safety and avoid potential interactions with medications or health conditions. That's all for our video on supplements for high blood pressure. We hope you found this information helpful and informative. If you'd like to learn more about nutrition and supplements, be sure to visit nutritionmarket.com.au, where you can find a wide range of high-quality supplements and access our virtual clinic with clinical nutritionists and naturopaths serving clients in Australia and around the world. Book a consultation today to get personalized advice tailored to your unique health needs. Don't forget to hit the like button and subscribe to our channel for more videos on nutrition, health, and wellness. And remember, while the information in this video is based on scientific research, it's not intended to replace advice from your healthcare provider. Some of the findings discussed may still be under investigation, so always consult with a qualified professional for personalized recommendations. Thanks for watching, and we'll see you next time.